Everyone out there, my name is Tinu-Smiles. Well, this morning I will be talking about the secrets concerning government hospitals in Nigeria. This is a live broadcast. It might only last for just a few minutes. I will come back later on in the day to have about an hour discussion. We might have one or two callers as time goes on. This same Nigeria in the 70s has been a very welcoming terrain whereby people even left the windows and doors opened at night in the 70s. I remembered the natural resources being appreciated and tapped by so many people from all walks of life. From all walks of life. People are so comfortable to be called Nigerians. I remembered back then in the 70s, people respect each other. Government hospitals back then were all equipped. You could walk into a general hospital and you will see a nurse come closer to you with a smile and attend to you. The rate of maternal mortality back then was very low, unlike today. Back then in the 70s, people will show love. They can walk, you walk to your neighbor and you smile, you have a good conversation. Things were definitely different then. But today, government hospitals in Nigeria are so terrible. Government hospitals in Nigeria today, in fact, they're in a very appalling state. People die frequently, and these are avoidable deaths. You walk into a government hospital today and you are being asked to buy a piece of cotton wool. You rush a patient to government hospital today. There might not be oxygen. The case of one of these popular dancer who went into government hospital, but he couldn't be treated. They took him to about 5 different hospitals due to lack of oxygen. He died. What is the government doing? Can't the government prioritize government hospitals? Isn't health important? So many students were free to walk around. Pregnant women in the past will go to government hospitals back then and be treated. Today, everyone who looks at people's stories or read people's stories will shake their heads. Everyone will shake their head. You hear someone died here, someone died there. Government hospitals, in fact, when you walk into a government hospital, for instance, the terrible environment will put you off. Odious smell. People waiting for so many hours unattended to. Some nurses would just shout at patients. I can assure you, out of 10 families in Nigeria today, 7 of them will tell you that they are not happy with the situation the government hospital is in. They will tell you the situation those hospitals' lives today is terrible. Why can't those rich and wealthy leaders walk hand in hand with wealthy religious leaders and start building government hospitals or try to revamp government hospitals? Why can't each one of them go into every government hospital in their state and start asking questions from people who need answers to their questions? Ask them what they need. They don't need something so big. It could be an inconspicuous medical equipment as long as it is effective. Buy it in every government hospital. Retrain the staff. Retrain the doctors. Don't sit down and watch all professionals, all your doctors relocating abroad. When all good doctors relocate abroad, when all nurses relocate abroad, what you're doing is that you're leaving that gap open. When the gap is open, it becomes a problem for the new doctors who are just graduating. When the new doctors graduate from universities that had no apparatus, universities without laboratories, what are they going to teach them? When all leaders have taken all their children abroad to study well, the children will not come back home to practice. They leave them abroad. And all they do is to equip young people. Most of these politicians, they will equip these young people with tools of destruction to start fighting their opponents. They turn them into sycophants. These young people become sycophants. And their children are doing so well. What happens? Why can't you now empower those young people coming up? When you empower them, they are able to become something good in the society. They are able to become relevant. They are able to create opportunities for other people coming up. I remember one of my interviews with Deputy Commissioner of Barbados. She said the government has given free education to all children in primary and secondary schools, to all their children. So job opportunities are so overwhelming in Barbados. Why can't you leave avenues, positive avenues for young people growing up, for children and young people? So many children are sleeping on the streets of Nigeria. So many of them have turned into cultists. So many of them have been captured while they're young. The future has been tampered with. What is really happening in Nigeria? For instance, some of these children will tell you they want to become a doctor or nurse when they grow up. How can they become doctors and nurses when there isn't resources to empower and nurture them? The gap left in government hospitals need to be filled. You have to train these children. You have to leave enough resources for students in universities. Girls would easily go into prostitution. One of those charity outreach I went for in Nigeria, I remembered some police officers came to me and they said the DPO would like me to please speak to some girls about 13, 14 years of age, gone into prostitution in Nigeria. These girls, some of them walk naked in hotels, the bar. They dance, they do pole dance and all that stuff. And older men who are old enough to be their grandfather throw money on them. Some girls have gone into prostitution at a very early age because they want to feed their parents. They want to feed themselves as well. There's nothing for them. Hello everyone. For those who are just joining in, I'm talking about government hospitals, the secrets about government hospitals. This is a very short audio. This is a very short audio message. If you would like to share, please share. What's going to happen is that later on, we'll be having a full discussion on government hospitals in Nigeria. What is your view about government hospitals? What do you want to contribute about government hospitals in Nigeria? What experience have you had? You're free to express yourself. What experience have you had with some hospitals there or government health centers? What experience have you had? What experience have you heard? What advice would you like to give to those leaders who are not doing anything about the situation on ground? People are dying. People are dying. And these deaths are avoidable. Most of these government hospitals will have a mortuary next to them. Do you expect your patients to die? Are they expecting death? When they take a patient to hospital, the family of the patient should be rest assured that they will attend to them and give the patient an adequate treatment. But does patients, most of those patients, do they receive adequate treatment? Some nurses work overnight. They work long hours, overtime. And I can assure you, some of them have not been paid for months. Like that frustration. They take the frustration out on patients. One of my charity projects the other time in Nigeria, I heard about a young lady. She was on with a scan. She went in for scan, pardon me. She went in for scan with her boyfriend. When the boyfriend realized that she was expecting twins, the boyfriend disappeared. He ran away because he didn't have money. He didn't have money to even take care of one baby, talk less of twins. And the girl was left alone to take care of the two babies. What are we doing? We people living abroad, we can't always complain about bad leadership in Nigeria. Yes, the situation on ground in Nigeria is not pleasant. We cannot pretend. So many people are not happy. So many young people are hungry. That is the truth. So many people in Nigeria are hungry. So many people are complaining. Inflation on foodstuff, inflation on almost everything. Even wealthy people are complaining. The other day, someone said a bag of rice is now 19,000 naira. Assuming they used to buy a whole bag of rice for about 10,000 naira, or even 8,000 naira, a bag of rice. The money they have today will only buy 1 or 2 cups of rice. They haven't got enough to buy anything. You hear people stealing people's food. People living in a very big compound and living in a community with overpopulation, less employment, less income. What they do, you hear people stealing people's rice. People stealing a pot of soup. Some people eat without soup. They eat without pieces of meat on their plate. Some people go to bed without anything. People need your help. We living abroad, please let us remember our family back home. Whatever we can do to help our friends, our relations, our neighbors back home, let us give. Let us help them. It is true that they are going through a lot, regardless their situation, regardless what they're going through. Let us help. Those people going through a lot of problem in Nigeria today, don't give up. We can hear about the situation of Nigerians who are suffering in the hands of evildoers in Libya. Don't rush to Libya. Traffickers out there, put a stop to it, because you're killing all our people in Libya. Those people are running away from poor governance. They're running away from terrorism. They're running away from police brutality. They're running away from unemployment. They're running away from poor hospitals, treatment from bad doctors, bad nurses in Nigeria. We do have very good professionals within the medical team in Nigeria. Don't forget that. We have good doctors, good nurses. We still have very measly numbers of good hospitals. They're not many. But the problem on ground now is that there are too many hospitals without equipment, too many hospitals without good nurses or doctors, or even nurses or doctors whose hands are folded to the back. Doctors who don't even know how to take care of the next patient. Because there's nothing, no resources, nothing on ground. There's nothing. Even doctors who own private hospitals. And let us try as much as possible to fight this fight with the government to reject importation of fake drugs. Someone said, "Oh, do you know that people sell drugs, expired drugs, at a cheaper rate in some pharmacies?" Who allows that? Health department, management there, do something. We have so many doctors. When you look at the NHS service in Britain today, do you know that at least we have about close to 40% Nigerians who are in top positions in medical field abroad? Nigerians are so appreciated within medical field abroad. Why aren't they appreciated back home? The interview I had with these three doctors said they would be so happy if they've received the same treatment in Nigeria. They said the government of Nigeria can invite doctors to come home and start training the new doctors. And I feel that is a way forward. A friend of mine, she has relocated to Nigeria so many years ago now. At least that's about 5 years now. She goes from one government hospital to another with her team, her medical team. And what these people do is that she and her team sit with the management of every government hospital they go to talk to them about the way to have a comfortable relationship with patients, a way to ease the pain, to ease pains of patients. They speak to patients after nothing.